Right now in the heart of Harare, a silent crisis is unfolding. The Tsikidzi outbreak at Matapi Flats is not just a nuisance. It's a full-blown public health emergency. Harare needs urgent action before it's too late. Let's hear what some residents have to say.
Mbare, Tsikidzi, takungotedzerwa saka tashaya mufaro toita neTsikidzi.
The capital city is currently facing a serious public health emergency. The widespread Tsikidzi outbreak that began in the densely populated flats of Mbare is now rapidly spreading to suburbs such as Mabvuku, Kuwadzana, and Budiriro. Disturbing footage has surfaced showing local workers revealing infested mattresses during routine moves, highlighting just how entrenched the manifestation has become. Although bedbugs do not spread diseases directly, their impact on public health is undeniable. Bites can lead to severe allergic reactions, secondary infections, and serious mental health challenges such as anxiety, insomnia, and depression. In Zimbabwe's already strained healthcare environment, these problems are compounded by overcrowding living conditions, poverty, and limited access to treatment. Residents, children, and the elderly are suffering both physically and emotionally. Without swift intervention, the infestation risks worsening psychological distress and eroding community health standards. The response from Harare's local authorities and national health institutions has been widely criticized. Initial fumigation efforts focused on Mbare, but many residents report that interventions have been slow, inconsistent, and ultimately ineffective. Mayor Jacob Mafume has acknowledged the gravity of the situation and pledged broader pest control programs, but trust remains low among citizens who feel abandoned. The unchecked movement of second-hand clothes and furniture across suburbs has further fueled the spread of the infestation, reflecting poor regulatory enforcement and health coordination. Let us hear what the mayor of Harare had to say.
In Mbare, to respond to the health crisis, bedbugs, which is caused by the bedbugs or Tsikidzi. We want to mobilize the community. We were with the chairman of the residence, the district officer, and our pest control department. How we are going to do it, we have in stock the chemicals that we need to spray, and we are going to buy more, and we'll get assistance from the ministry. Once we will train volunteers from the community, so that the community inotibetsera, and then we'll calendarize this fumigation so that this will not erupt in the short term. Of course, in the long term, we need to assist people to deal with the many issues that are here in terms of sewage and other things, and also to improve the flats and make sure that people are comfortable. So there will be community assistance, community help, and we will try to make sure that people are helped to deal with this problem as quickly and efficiently as possible. So thankfully we have the chemicals in stock, and whilst they are using that chemical, we should be able to purchase more to be able to deal with the rest of the infestation, which according to the anecdotal testimonies that I saw, had reached biblical proportions. So we want to respond with also biblical vengeance against this pestilence. Spray all these flats where this is, sort of avoid it crossing over to other parts of the city. Each part of the city has got its own pest problems. Some have fly problems, some have what we call the mosquito problems. So it depends on the area. This area, because of the peculiarities and the densities of the people, has got this particular problem, and also the storage of certain items for sale. So this particular place has got this particular problem, but we do pest control all over the city depending on the problem of that particular area. So we will deal with this area completely. Then we will also see how far that goes. If we control it, then we calendarize the pest control using our pest control department.
Asikona mai mune waya yakadai soka. Mune muda kutosprewa dzimba dzese nemumarata omudengo. Wodziona kufamba kubva munext dzakudzoka futi kuno.
The Tsikidzi crisis exposed the chronic underfunding, mismanagement, and lack of preparedness that continues to undermine Zimbabwe's delivery systems. The Tsikidzi outbreak is not merely an inconvenience. It is a public health emergency with far-reaching consequences beyond physical discomfort. Bedbug infestations disrupt sleep, mental health, school attendance, and work productivity. Secondary infections from constant scratching can further burden the fragile healthcare system in Zimbabwe. Failing to act decisively could deepen social distress and economic hardship in an already vulnerable communities. Let's take a look at global lessons on how other countries have responded to similar outbreaks. Similar outbreaks have hit major cities around the world. Paris experienced a bedbug epidemic in 2023, prompting an aggressive national response, emergency fumigation efforts, public education campaigns, and a high level of coordination ahead of the Olympic Games. In South Korea, authorities took a different approach, deploying trained sniffer dogs at airports, and ramping up inspection programs to prevent the spread of bedbugs via public transportation and hotels. These show that successful management depends on rapid, well-funded, and multi-pronged action plans, something Zimbabwe's response must urgently emulate. This is ZimRise TV.